This is a public broadcast. All the world is a stage, and all the men and women merely players. Why should a YouTube video be any different? In this video series, at times, you, dear viewer, play the part of a tinfoil wearing individual. It is just a part. None of my dialogues are demeaning you personally, unless, of course, you truly are one of those tinfoil wearing individual. Thank you for your understanding.
I wanted to share with you what this means. When you go out in public and you wear this at all hours of day that you're outside, you are doing your body a disservice.
What the? We're all stupid. We're all going to die. Before diving into it, first let's compare different type of face masks. We have surgical masks and respirators. Draping a cloth around your face would be classified as a surgical mask. This kind of masks protects you from infectious agents transmitted by droplets. These droplets can be droplets of saliva or secretions from the upper respiratory tract when the wearer exhales. A respiratory, on the other hand, prevents the wearer from inhaling aerosols like dust, smoke, mist, as well as vapors and gases that are health hazards. It also protects the wearer from airborne infection agents like coronavirus, SARS, H1N1, etc. In Europe, respirators must meet the European standard EN 149:2001, which has three classes of disposable respirators: FFP1, FFP2, and FFP3. When talking about respirators, we use a value called leakage. For coronavirus, medical professionals use FFP3 certified that has a maximum leakage of 2%. Where surgical masks are not designed to seal tightly to the face or filtered small airborne contaminant, so that leakage value doesn't really apply. I believe that these clarifications are needed before trying to understand what she is saying.
You have respiratory alkalosis, which can be caused by anxiety or from hyperventilating. The treatment is this.
Hyperventilation is a condition in which you start to breathe very fast, which causes the body to lose CO2. You need a minimum amount in your bloodstream to maintain your body's pH balance. The idea behind breathing into a paper bag is that rebreathing exhaled air helps your body put the carbon dioxide back into your blood. While breathing into a paper bag can work in theory, many doctors and patients don't find it to be particularly quick or effective method. Even then, there are precautions when using the bag method. Number 1, do not hold the bag for the person who's hyperventilating. Allow the person to hold the bag themselves. Number 2, do not use a plastic bag. If you put a plastic bag over your head and tie it tight around your neck, no virus could get in, but neither could any oxygen, and you would suffocate. Not recommended. So is her comparison valid? Well, it's highly unlikely that you'd pass out from a lack of oxygen with a surgical mask, which generally doesn't fit tightly to your face. When you exhale or inhale, air can go around the mask as well through the pores in the material. Remember this line, it will become important later. This is why this mask does not absolutely protect you from inhaling the virus, But by disturbing your exhalation flow, it tends to protect those around you from aerosols in your breath. Inhaling high levels of carbon dioxide may be life-threatening. Carbon dioxide toxicity can cause headache, vertigo, double vision, inability to concentrate, tinnitus, which is hearing a noise like a ringing or buzzing that's not caused by an outside source, seizures, or suffocation due to displacement of air. But the emphasis here is high levels. Let's see some real-life examples where people wear surgical masks a lot of the time, though we might be calling those by a different name, like balaclava or bandana. If you're an American, you might also know it as ski mask. Race drivers must wear balaclavas made from fire-retardant material underneath their crash helmets. Remember that long list of what high-level CO2 does? Can you imagine having double vision or unable to concentrate while driving, let alone that car being a race car, and instead of driving down at 20 miles per hour, you're going significantly faster? The United States Marine Corps uses balaclavas with hinged face guards as part of their flame resistance organizational gear program. In the Soviet Union, the balaclava became a part of standard OMON, that's a special police task force, uniform as early as 1980. Then there is bandana, which became an important symbol in the fight for workers' rights. The West Virginia coal miners in March of 1921 was one of the largest armed uprisings in labor history. And at the march, over 10,000 United Mine Workers wore red bandanas to demand unions. An event many equates to the popularization of the derogatory term redneck. Unlike surgical masks, N95 masks or respirators actually cut down the oxygen supply by up to 20%, coupled with the fact of additional carbon dioxide inhalation, often leading users to feel tired, nausea, and can lead to other more serious medical conditions. Last of any breath you exhale from lower lung is called end-tidal breath, has approximately 100 times more carbon dioxide than inhaled in fresh air. When exhaled into a tight-fitting partial rebreather mask designed to capture the last 100 to 300 milliliter without leaking, think of a snorkel. Since carbon dioxide is heavier than air, it will stay in the bottom of the snorkel for rebreathing even if the top is left open to air. This does slightly increase something called dead space in respiration and hampers breathing a bit by making the air reaching the lungs having slightly more carbon dioxide. Similar to a very long snorkel, a mask slightly increases dead space, but since it's porous, the volume of dead space is slightly less than the volume of space between the mask and your face. 250 to 350 parts per million is the normal background concentration of CO2 in outdoor ambient air. 5000 ppm is the workplace exposure limit in most jurisdictions. That's over 14 times the normal CO2 level. So it would take a dead space increase of a very large volume to cause serious problems. That's a very smart, long way of saying you'd be fine.
This mask is highly ineffective against viruses.
Her next comment is that this kind of mask does not protect you for virus. Well, as Homer would say, duh! To me, you might as well say it doesn't stop teenage pregnancy. And my reply would always be the same. It's not meant to. Your assumption is it does A, and then bitch that it cannot possibly do A. So who's the S here? I mentioned earlier, surgical mask does not absolutely protect you from inhaling the virus, but by disturbing your exhalation flow, it tends to protect those around you from aerosols in your breath, That's why government is asking us to wear it, is so we can try to limit giving it to other people in case we're infected. Do you understand?
An N95 mask has to be fitted, first of all, and is supposed to protect you against TB.
Then she talks about mask designed to stop TB and it being a bacteria. Well, completely correct. In fact, the largest virus is smaller than the tiniest bacteria. Remember those mask certification we briefly touched earlier? Well, FFP2 mask can also serve as protection against influenza viruses such as avian influenza, as well as against bacteria of pneumonic plague and tuberculosis. It's similar to the N95 mask. Well, who would have guessed that a certified mask can stop a large TB bacteria as well as a smaller influenza? I'll give her the benefit of doubt that maybe before the pandemic started, someone gave her a N95 mask and said, "This is to protect you from TB." And now they're giving her the very same mask and her tiny head explodes. They're all lying to us.
I want you to think about that. I want everyone to think about this. It's not common knowledge, apparently. You're doing your body a disservice
when you listen to misinformation like this. Repeat after me. The reason we should wear masks in public so we don't give it to other people in case we are infected. Remember that we can be asymptomatic or might just be in the incubation period.
I know I'm probably going to get a lot of flack for this.
Yes, you should get a lot of flack for this. Yes, people should stand up for what they know to be true, which is not fiction, but based on real science. Scary part is, you're only thinking of yourself and your immunity system, where the rest of us are thinking of other people. If you think your body knows far better than we do, you're really in the wrong profession. Maybe you'd be happier working in a crystal shop. If you have meant the qualifier when we give it the right tools, well, in that case, that's exactly what we are doing. That mask is a right tool. Please, people, don't listen with your heart. Let it do what it does best, that's pumping blood. Let's all use this thing we call a brain instead. Shall we? One driver who crashed his SUV into a pole in Lincoln Park, New Jersey on April 23rd actually blamed his collision on his mask. He told police he passed out because he's been wearing an N95 mask for too long. Initially, the investigating officers believed him, writing in a Facebook post that he was the only person in the car and passed out due to insufficient oxygen intake and excessive carbon dioxide intake. The post was shared more than 2,700 times and received hundreds of comments, with a few sharing their own experience of feeling smothered by this type of mask. The police department later updated their post, stating that they didn't know with 100% certainty that excessive wearing of an N95 mask was a contributing factor to the accident. They added it is certainly possible that some other medical reasons could have contributed to the driver passing out. One final thought. There is a very special place for those who videos in portrait mode. Just saying.